Hi, I'm Dr. Sam, here to coach you to bright, clear skin like I've done for thousands of patients at my Harley Street clinic. And today we're tackling vitamin C. Such a popular ingredient, and rightly so, because it is a great all-rounder for those of you suffering from the signs of premature aging and sun damage, because it's great for pigmentation, it's great for building collagen, it's anti-inflammatory, and it's a powerful antioxidant. So it's the perfect partner for your daily sunscreen. And it's also a super easy ingredient to build into your morning routine, which is when I like to use it. When you're ready to go out and do battle with the environmental aggressors, like UV and pollution especially. So if you're an urban dweller who works out outdoors, you wanna watch this video. This one's for you. So I'm going to demo this using the SkinCeuticals CE Ferulic, a classic, 15% L-ascorbic acid. Now I was going to use the new version, which is the Silymarin CF, also 15% L-ascorbic acid, but also has this interesting ingredient, Silymarin, which is derived from milk thistle, which you might be more familiar of in context of it being something that we take orally to help detoxify, particularly after a big night. So it's meant to help with kind of recovery from too much alcohol. However, they've made this one to target blemish-prone anti-aging concerned skin, so it's got a tiny bit of salicylic acid in it, 0.5%. Great news if you're blemish-prone, because I don't tend to use vitamin C in the acute stage of somebody breaking out, but it does limit the use of this, as I'll show you later. So we're going to do the CE Ferulic today. Just wanted to draw attention to that new product. So I'm going to use 7 drops of CE Ferulic because I want to treat my full face, my eye area, and my neck area. So I'm going to do 13 dots as usual. And as I said, I'm going in with 15% L-ascorbic acid. I'm going to put a little bit around the eyes as well. And I just do like 3 little dots there. And then I'll take the rest down my neck after I've worked it in. So 15% for my skin, which is normal combination, albeit a little bit redness prone. But you can start off lower. You can do 5, 10% if you have sensitive skin and you're just starting out. And you can go up to 20% if your skin is kind of tolerant, oily, resistant skin, as we talk about. So as I said, I want to use it all over, including my eye area. Again, if you're starting out, don't rush into that, but with time, if you're comfortable with it on the rest of your skin, you'll want to harness the benefits of it over your eye area because it's good for collagen production, it's good for pigmentation, and it's a powerful antioxidant. So it's going to help prevent future sun damage. And then I'm going to take it down my neck as well. If ever there's a part of the body that loves vitamin C, it's the neck. And I'm just going to glide that down. And I think this is a really powerful way to maintain the health of your neck, which is naturally very thin-skinned, so often susceptible to inadvertent UV damage. We forget about our necks, but the same kind of quality of skin on the neck as around the eyes. It's thinner, and therefore we have to work harder, but it's also prone to irritation. So retinoids can be really difficult to tolerate on the neck, certainly at the beginning anyway. So I'm a big fan of vitamin C as one of the first actives for both the eye area and the neck area. So vitamin C, I tend to always apply to clean skin as one of my first actives. And I think that's firstly because it tends to be quite an expensive product, so you want to maximize penetration to avoid layering it over anything that might reduce its penetration. But the other aspect of it is that it plays very well with other active ingredients as well. So I might want to layer azelaic acid over the top if I'm concerned about pigmentation, or if I wanted to use AHAs if I was concerned about radiance and glow. Now, a common question is, how often can I use vitamin C? And the answer is every day. Ideally, we replace vitamins in the skin every single day. But again, if you're sensitive, I'd always recommend starting an active at a lower quantity. So maybe use 2 or 3 drops. You can even just use it on a sort of test patch kind of way, using the forehead, and do it less often. Try it every other day, and then slowly but surely build up to daily use. As I say, you want to build up to, replacing vitamin C every single day if you can. Now, L-ascorbic acid tends to be formulated at a low pH to ensure it actually penetrates the skin. That can be very irritating for sensitive skin. So in those instances of L-ascorbic acid type preparations, so like the SkinCeuticals one, or the Obagi system, the Pro C range, if that doesn't suit you, then consider trying a vitamin C ester like ascorbyl glucoside, which tends to be that bit gentler, doesn't have to be formulated at low pH, and can often be better tolerated. Now, there's a lot of anxiety around using vitamin C and niacinamide together, and I want to reassure you that that's completely fine as a combination. The anxiety was based on an old study, and newer formulations ensure that the two are entirely compatible. And I'd even go as far to say synergistic, because they're both particularly helpful in skin that's been exposed to UV rays in the past. Other active ingredients that play well, as I said, AHAs and azelaic acid are both good in combination with vitamin C. Retinoids always tend to get used at night, and I tend to always use vitamin C in the day. So I see no instance where you would need to stack the two together. You might find that they're an irritating combination, they can be, but in practice, because you tend to use your retinoid at night, vitamin C in the day, they play well with each other as long as used separately. The one active I would avoid using with vitamin C is benzoyl peroxide, where the benzoyl peroxide may end up oxidizing your vitamin C, rendering it useless. So that's a combination I wouldn't tend to use together. But in reality, again, I don't tend to use vitamin C in actively breaking out skin. So if you're using benzoyl peroxide, the chances are I'm not having you use vitamin C at the same time. That tends to be used later when breakouts are well controlled and you're focusing more on pigmentation treatment. Other considerations with vitamin C is how you store it. And it's very important to keep it in its box and to keep it away from light. And also, if you've got a dropper format, as many of them are, to keep the lid tightly turned on. I'm going to show you what it looks like when someone has left the top off. It goes really dark like this, so I tend not to recommend using it if it's any darker than that straw color that you saw me use earlier. So that means it's been oxidized. So that's everything I think that you need to know about vitamin C to use it like a pro. It's such a great all-rounder, an ingredient that's to say that plays well with most other ingredients, particularly those used in the treatment of sun damage and the first signs of aging. And I think it's really well tolerated as well. And you get collagen building, anti-inflammatory properties, antioxidant properties, and you get some help with pigmentation too. So what's not to like? So I hope that that video helped answer your most common questions around how to get the most out of what can often be quite a pricey investment, but one that is really worthwhile when we're talking about safeguarding the future of your skin. So I want you to really use it with confidence and with enthusiasm. And if you found this video helpful, please do share it with someone who needs some guidance around using their actives. I've been doing this series covering the most popular ingredients, and I really do hope it's helping you approach your skincare routine with new enthusiasm and optimism. Bye for now.